1 in 6 men in the UK will get prostate cancer at some point in their lives. The main risk factors are age. The older you are, the more likely you are to have a diagnosis of prostate cancer. There's ethnicity. If you're a black man in particular, you're at higher risk of having a prostate cancer diagnosis, and you're also at higher risk of having a clinically significant life-threatening prostate cancer. A family history is also important. So if you have a father, a brother, a grandfather, or an uncle that has a history of prostate cancer, it puts you at higher risk. There are some genetic conditions that also leave some individuals vulnerable. This might be a history of BRCA genes in the family or Lynch syndrome. BRCA gene is also associated with breast cancer, so it's worth thinking about a history of breast cancer in your mother or sisters. There's also a risk factor of obesity. This is one of those factors where you can make a difference if you're overweight. Exercise and lose weight. Patients typically see their GP with concerns around urinary symptoms or prostate cancer itself. It's something that's increasingly spoke about in social media, with high-profile celebrities sharing their experiences and diagnosis of prostate cancer. At this point, there may be an examination of the prostate gland, something called a digital rectal examination, to feel the gland and if it's abnormal. There's typically a blood test. The blood test is looking for PSA. PSA is a protein produced by the prostate gland, and if it's elevated, it puts you at higher risk of having prostate cancer. Depending on these preliminary assessments, taking into account risk factors, an MRI scan of the prostate could be indicated. The MRI scan considers if there are any lesions that are appropriate to biopsy, and also where biopsies could be guided. The biopsies are referred to as transperineal biopsies in the clinic. Here, there's a needle being passed into the prostate gland to sample the tissue to look under the microscope to see if there's any cancer cells. The biopsy needles pass through the skin between the testicles and the back passage, and this is done under either local anesthesia or general anesthesia. With general anesthesia, you'll be asleep and you won't feel anything. Depending on those findings and a diagnosis of prostate cancer, there may be further tests to define the extent of cancer. This might involve a CT scan, a specialized version of a CT scan called PET scan, or a bone scan. Cancer confined to the prostate gland has an excellent outlook with careful management. Options include monitoring in some cases where there are features of indolent disease. This is low-grade, localized stage disease. If there are any changes in the nature of that cancer during surveillance, such as a change in the PSA, growth in the lesion, then you can consider treatment. In some cases, if there are features of risk as high-grade disease or a large burden of disease in the prostate, then treatment could be indicated from the very start. This includes surgery to remove the prostate. It includes radiotherapy. It includes treatments to target just the lesion within the prostate using focal therapy. The main side effects of treatment involve urinary problems such as incontinence, effects on erections and loss of erections. With radiotherapy, we can also see irritation to the bladder and the back passage, leading to symptoms. There's also a small increase in a risk in secondary cancers with radiotherapy. Hormones may also be used for patients that have high-risk features undergoing radiotherapy, and those themselves can lead to an impact on the quality of life. We can minimize these side effects in certain cases, where indicated, we could consider an approach of focal therapy, where a needle is passed into the prostate and treats only the area where there is cancer. However, rates of recurrence are higher and the need for further treatment is required in a proportion of patients.